You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He's got a lot of great photos and stories to tell us. Dr. Joe Gillespie. Dr. Gillespie, welcome to the program.
Hey, Randy, it's great to be back. Thanks for inviting me back.
All right, yeah. I'm glad you finally made it. Now, we probably won't be able to get to all those photos, but you brought some dramatic photos.
Yes, sir.
Now, for people that don't know your practice, I guess your practice is where people can walk in with no teeth and walk out with teeth.
You're exactly right. And
so who is the typical patient of yours?
The great story about our typical patients is, I can tell you what happened in my office yesterday.
Okay.
We fixed 3 smiles, and I was only there for 5 hours. So I was flying to come see you. So in the morning, it was a full arch smile on a gentleman, 70s-ish, and made him young, happy, and cheerful again. I called him.
So these are people that would have been wearing dentures.
Yes, that's correct.
But now you're giving them.
So his case particularly was permanent teeth that would be cemented back in his mouth. The next patient that we treated, we just essentially assisted their denture experience. We enhanced it using mini dental implants. And the third young lady, missing a front tooth that we were able to fix in 30 minutes, replacing her space in the front. I mean, that's the most important, the front 6 teeth. So she had a space up there, and in 30 minutes, she didn't.
Now, you have a very busy practice, so you pretty much focus on replacing missing teeth with dental implants. That's almost all you do?
So I have a general practice, an associate that handles the general dentistry. So we do one-stop shop, do it all, but my focus is really just helping people with implants. Okay,
now you also teach.
That's correct.
I mean, what we're talking about today as far as replacing missing teeth, giving people a full set of teeth.
That's correct.
With implants. You lecture to what, dentists from all over the country?
At least once, maybe twice a month, and we do international as well. So this year we've been to Australia, Tokyo, Japan, India. It's been a pretty exciting year. So domestic is where we spend the lion's share of our time, helping U.S. dentists be able to assist their patients' needs. But it's just something we do every day. It's called a wet-fingered clinician. So in my office, you do it 4 days a week, and you teach it on the weekend.
Is there now? You're on TV a lot.
I am, yes.
You know, I've interviewed you before.
Yes. That's right.
But you say that people come in and they're still skeptical, like going, are you sure, Dr. Gillespie, can this happen?
The funniest story along those lines is a gentleman came to me after watching essentially one of our interviews.
Okay.
And he recorded it. When he recorded it, he watched it once himself. He showed his wife and they watched it together. And the third time, he watched it again. An hour and a half of his life was spent with no car explosions, no car chases, and he already had a rapport with me. But certainly anything you see on television brings that natural skepticism of are you sure? And by the time we were at the end with how little of an impact we made in his life, how quickly we were getting fixed up, it went in his office, I mean, because he came to visit us, his one office visit, day 1, consultation. Second visit, we treated him, and he was just right out to the races, happy with the care. So with him, he came in missing teeth, and we ended up giving him a permanent set of teeth on the upper, and essentially just restored his entire smile. So it just made life for him back the way it should be.
Now, are you getting more people that want to avoid dentures? That means their teeth are about to come out. Or are you getting more of the people that are wearing dentures and want something, you know, locked in there?
All over the spectrum. Our particular offering is called Great on 8, and that's rehabilitating the denture wearer who struggles day in and day out with problems eating, uncomfortable fits, the horrible adhesives and messy glues, and the embarrassment, sort of that I can't order what I want, I can't do what I want to do. And the dentures actually take over the patient's life. It affects what they order for their meals. It affects when they may want to go out and socialize. They might not stay after for the buffet at church, of all things, and kind of shuffle home like a recluse, rather than heading out.
Because what, they can't chew very well?
They just don't have the function. I think the misperception is, okay, I'm losing my natural teeth. A denture's going to be as good. Nothing's as good as God's teeth until you enter in with the implants, and that's almost as good. I mean, it really is something with a denture that you can snap in. So we can start there. I call it denture stabilization. Use a couple implants, very affordable, very fast treatment in all honesty. From beginning to end, we're done in under an hour on those cases, and it's immediate. They can come in with a denture they're wearing and walk out with a complete different experience. The other side of that is this Great on 8, permanent teeth back in the mouth. So now a denture wearer comes in my office and doesn't realize they could even have their teeth back because The only reality to them is this daily grind of having to put up with a denture. So when we get to show them sort of the light, if you will, or the other side of the tunnel, or actually what we've been able to accomplish with advancements in dentistry and minimally invasive techniques and things that actually aren't even surgery, we're able to very quickly then design a new smile that's as close to their natural teeth as we can get.
So what can they eat? Okay, so somebody comes in, by the way.
Sure.
And they were a denture wearer.
Yes.
And in a couple of visits, I guess if everything goes all right, they can walk out with teeth that don't come in and out.
That's correct.
How soon can they eat? And what can they eat over
They're
time?
never not going to be able to eat, and that's the strategy here. It's immediate care. So the same day we place implants, we put them into function. There's no long healing times. You're not going to wait 4 or 6 months with nothing to do. That would be a very difficult purgatory in my mind, to have something placed and then have a compromise, have to say, well, now don't eat anything for 4 months. That's not our reality in many implants. The same day the implants go in, we will enhance whatever they have, because that might be a snapped-in denture, but we're designing the new smile, and that needs to be a couple of things. It needs to be age appropriate. It needs to be the shade that the patient designs. And the neat thing about it is I think of myself as the engineer, and I'm kind of the guy in the train that shovels the coal, but the person that's directing the train, that's kind of telling us where we go, is the patient. So it's very aesthetically driven.
So these teeth look real.
They look absolutely seamless to what the patient would desire. And we sometimes need to steer off of like refrigerator white for people who come in and say, man, I want to go over the top. If they have lighter features, you can match those lighter features with light eyes and lighter skin tones. But with very dark features, to put the contrast of bright white teeth in, it's just kind of unnatural.
But back to the eating question.
Please,
so in a week, I mean, they could bite into a steak or eat ribs or whatever?
With their decision, mattering on which solution with us they go, we won't limit their eating. Steak is definitely very quickly on the menu. I wouldn't be able to stop the gentleman that comes see us in the office from steak, because there's nothing holding them back. They're going to throw the denture adhesive away. They've got teeth that they can use and function with. It's steak, it's nuts. It is the nutritious food. That's the corn on the cob. You're actually tearing it with your teeth.
The front teeth.
100%. That's probably, we're in Charleston, South Carolina. That's one of the big kind of nutritional selling points. You're looking at healthy foods straight from essentially the garden or the farm. Exactly right. And then the other things are pretty simple. Apples right off the core, if you will.
With the front teeth, though?
With the front teeth.
You can bite an apple.
You can bite an apple. It's been that way. I mean, I've been doing it for 13 years. Time in, time out. Patients say, I had no idea I wouldn't be slicing apple or having to choose applesauce or blending it, heaven forbid.
So this is definitely the newest, hottest trend.
So certainly the hottest
mini
trend.
Implants.
You're right. Certainly the hottest trend. I would say at one time, 13 years ago when we started, there were about 3 or 4 companies that made mini implant variety. Now there's 16, and everyone's jumped on the implant train. You'll see sort of advertisements. The funny thing is we have been the dental implant center in our area since we opened, and that's my focus.
You've done like thousands of these, right?
10,000 plus.
Is there a big learning curve, by the way?
Oh, I mean,
because you teach other guys how to do it.
I teach it. That's exactly right. There is certainly a component of sort of the education process, and there are stages that you can kind of go through.
Does it cost more to go to a guy like you?
It
by the way,
actually doesn't, believe it or not. Price point wise, there's
the same wherever you go.
There's just a market. There's a market that you need to fill.
Now let me get this straight. So the way it's normally done is you go to one person that does the surgery.
Now you're right.
Right, and then another person that puts the teeth on top. But you do it all right there with the mini implant.
Call it the ping pong effect. You'll go have the surgeon do the implant and bounce over to this person, and sometimes they're not gelling. They're not on the same page, so you have some inefficiencies there. What office am I going to have to go to today? We do that one-stop shop, all in one location, the implant and the teeth. And the most important thing about that is we give the entire fee, the entire price. It just hurts my heart. Sometimes we might get a bill, or they might be told what the fee for the implants are, and then what happens on the other side? Oh, well, the teeth are this much more. And I don't want to have any surprises for my patients. I'd actually like to surprise them and always have the fee be less, because dental insurance will pay some.
Now here in the U.S., I guess Medicare, Medicaid does not cover this.
Correct.
Insurance, even the best insurance, maybe maximum payout might be $1,500 or so, but you offer financing.
Financing
you're big on
for
financing.
The rest. Big time on financing, just because we want to make this affordable. So we have payment plans that actually start at under $100 a month. With our financing, that's just a target that allows people to be able to say yes.
Now, you say you're changing people's lives, and you brought some photos.
I did.
Let's take a look.
Our first case we're talking about there is a patient that came in and was really one of those struggling denture wearers. Had all the telltale signs of hating the adhesive, swallowing the adhesive, having those sensations of an awkwardness, something that wasn't self. And actually the story was, he told me that dentures fit like a bit in a horse's mouth. And that's something he felt like he could never get used to. And that bit, as you think of it, is something that's so foreign, and I mean, it only wears the horse's teeth. So when we showed him the models and let him see what we could do, we did an upper and lower case the same day. He just wanted to come in and get it all fixed. So the upper, we actually made a horseshoe, so there's nothing covering the roof of his mouth immediately. And I saw him 48 hours after we did the procedure. He was talking about the flavor, the taste, the food, enjoyment that came out of just having that palate removed. And the second part was how secure it felt. He's
so
like,
full arch of teeth on the upper, full on the lower.
Full on the upper and lower. We did it in one day, done in about an hour and a half, and 48 hours. We see him at a recall, and he could already eat, chew, and enjoy, and just seamlessly.
What about chewy foods like pizza?
It's going to be
no problem.
No problem.
Now,
no
look,
challenge.
He's kind of a bigger guy, right?
Sure, sure.
I've had doctors talk to me and say, Randy, the problem with mini implants, they're really only good for little, tiny people, like a woman in her 80s. So you can be big and do this. You can be big and do this.
You can have ample bone. You can have less bone. Actually, the longer that you wear a denture by itself, you actually lose bone over time. So we're doing two things. We are helping immediately give patients function, but long term, we're preventing problems down the road.
Like their face sinking
Sure, exactly.
in, things like
so
that?
When implants go in, it actually fools the bone. The bone thinks it's holding teeth and preserves the bone. So now issues that would pop up later, we're circumventing and we're getting away from.
So when it's all done, guys like this, what do they say to you?
He kicks himself.
For what?
Why in the world didn't I hear about this, do this forever ago? He's been a denture wearer for some time. This was his ticket, and he only found out about it late.
And he saw you on the program?
He did.
Did they ask about me on the show?
So they say you're too tough on me.
I know. I'm going to listen today.
No.
I'm going to let you do your thing. We're going to take a quick break.
Great, thank you.
And when we come back, more about the process.
Perfect.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Well, thanks, Eddie, for coming in today.
No problem, Joe.
Appreciate it. So we did for you a technique called third tooth. Your first set of teeth is your baby teeth, and you lose those whenever you're about 10, get replaced by your adult teeth. Sadly, if we have an issue or loss, and that's what we had with you. Same day technique, we gave you what we call our third set of teeth, our third tooth. How's it been for you?
It was fantastic. I have to tell you, I had no pain, no discomfort.
I love my third tooth.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. And according to Dr. Gillespie, nobody should be wearing a loose-fitting denture. Dr. Gillespie, welcome back.
Hey, excellent.
So you have more photos.
I do. Let's take a look.
All right.
This patient suffered from what I call a floating denture, and that floating denture on the upper just didn't perform, wasn't able to do what teeth should do. So we had a little conversation about permanent upper teeth that were cemented on top of our implants. And we call that grade on 8 in our office, and it solved all of our
Those
problems.
look like veneers.
They are stunning porcelain cemented teeth. They are in there like a full smile. And look at her just a bit. Look at how the lip line is cradled with a smile. By
nice.
Veneer, we're out in California, so veneer in my mind in California is, hey, this is that Hollywood look. We can create very beautiful aesthetic looks that put the lip line fully supported, that gives us that curvature and certainly the aesthetic line that's so important with women who smile more full than men. They have higher lip pulls. So whenever we play the game right and we fit in with some of these little tricks of the trade, if you will, the cosmetic tricks, you can combine replacing teeth permanently and the beautiful cosmetic dentistry into one and make a great result.
That's a pretty smile, though.
Oh, thank you.
So you helped design that.
That's exactly right.
Okay.
As we move forward with designs for smiles, making folks real happy, there's a couple sort of cosmetic tricks of the trade that you can bring in and control the lip line and really just cheer people up. I mean, look at that
but
smile.
You're a dentist. Of course you think the smile is important. Probably the most important thing.
So, I mean, take the dentist aspect out of it. Look at all surveys out there that say the most aesthetic thing or the most drawing thing of a person, and it's going to be in the top 3. But
Smile, yeah, that's true.
think about the whole side of that of People that smile more, people that have that charisma, people that are sort of tied in for who you'd want to hire if you're hiring, or who you'd want to land a job would be that person that smiles more frequently. So it's the center of the face. And really, when you think about it, it's an important key factor in essentially a life plan and a strategy towards overall happiness. So
You say they're discriminated against
folks-
when you have bad teeth. What does that mean?
the folks that don't have a good smile are going to suffer from, and it's unfair, but suffer from a bit of a discrimination towards a number of factors. Low income, that they don't take care of themselves, they might be unhealthy. The honest truth is they might have just been dealt a tough card of the soft tooth gene. There's a distant relative that handed it down, and they're brushing 3 times more than someone who has hard, healthy teeth. They're doing mouthwashes 100 times a day. They've seen the dentist and get bad news every time that they go about a new cavity here, and it's not their fault. The reality is, because of this one little gene issue, they're looked down upon. And it shouldn't be that way. We can
That's
come
true.
in.
Even
we
in the
can come
movies, I'm a movie buff.
You're right, completely.
And we were talking in the green room.
That's right.
That when you want to make somebody mean or bad or a villain in a
Mess
movie,
up
you
their
gray their teeth.
make them dark. The sales guys are all full grills, kind of overly exaggerated.
You want to make them look
teeth.
phony, yeah, you give them big
phony,
teeth.
too big. But there's a zen sort of position in between that we can live in to make the size fit. It's called a golden proportion, but you bring in this look that's pleasing to the eyes. And these folks, when we fix smiles now, get hired, get the better jobs, get the promotions. I mean, it's all one of these paths straight up.
I mean, are there really a lot of people where you are that are wearing either an upper or lower denture or headed to dentures?
So you'd be floored. We have big sports venues. The Joe Riley's our baseball. We have a Coliseum for our music. We have an ice hockey. If you put and filled all those stadiums to the brim, there's still not as many as we have denture wearers and folks who struggle with their dentures. You'd be
Why aren't
amazed.
they all doing it? Why aren't they all coming in and saying,
There's this secret culture, and it's sort of honestly a suffering in silence, if you will. There's this kind of image or thought process, and a lot of patients that I speak with about a finality of man, I haven't seen the dentist in forever because I had my teeth pulled, and my teeth gave me so much trouble that was it. I was just done with them. And that's not an easy visit. A visit that you have all your teeth extracted to get a denture is, in a lot of patients' mind, their last visit to the dentist.
So
I'm
the last
done.
thing they want to do is see
wave
you.
the white flag and surrender. But then the reality of what a denture can't do for them starts to settle in. And it's these adhesives and these relines that don't work. The secret is actually the implant. But the funny thing about it, when you compare the two, an extraction is difficult. It's not an easy visit. An implant, particularly a mini implant, because it's non-surgical, is much easier. Something we have to do. We have to go to the dentist and have to get over that hump with them. But they come in and they're skeptical or they're concerned about, here we go again with another dentist. The nice thing about the implants, we're throwing all that old problems away. So
Good.
you don't have cavities in a mini implant, so
Good.
we don't have to worry about soft teeth. And we're able to fix them and turn that circle of discrimination around. I mean, they just become themselves again. So
With a new smile.
when I was cool in high school is kind of that story. It's like, oh man, I'm back. And turning back the dial, I mean, everyone younger,
Can you be
healthier.
80 years old to do this, or
The
is that
oldest
too
patient
old?
I've treated is 94
Why
years
would a
old.
90-year-old want to do this?
Quality of life issue was his statement. I mean, he said to me, I've got tons. I'm going to give the grandkids plenty. I want to enjoy my life. And every year we've seen him 3 years since, so he's 97 now.
So he can eat whatever he wants.
He can eat whatever he wants. He goes and
That's
hangs out with the grandkids and does what he wants to do. And by goodness, he would never look back on the decision.
We're
Love
going
the
to
decision.
take a quick break, and we're going to get to these photos.
Great.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Thanks for coming in.
Oh, you're welcome.
Having a chance to visit.
Great.
We want to talk a
Okay.
bit about smiles.
All right.
Best work that I feel like a dentist can do is a set of teeth that patients don't even think about because it's so much a part of them.
This is one thing that I can honestly say changes your life. It's been a life-changing experience for me,
So
and I have some beautiful teeth.
You do.
The Dental Implant Center. Call today for your free consultation.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, no more dentures, according to Dr. Gillespie. Okay, Dr. Gillespie, you have more photos.
Let's
okay,
look.
so we're talking about, for people just tuning in, replacing missing teeth with mini dental implants.
right.
In one day.
And one day,
So maybe one visit, they go back, they could have no teeth, and they walk out with full arch on the upper and lower that don't come in and out.
the first visit with us is a consult, get
Okay.
everything lined up. Second visit is treatment. So that's that one treatment day. And I have a case to show you, which actually is the toughest bite I've ever fixed. So if you've ever seen them, and it sort of does look like an English bulldog, there's a classification for it in dentistry, but when you bite, and the bottom teeth bite in front of the tops, that's that look that you're used to seeing. So we have to overcome a lot of those challenges when it comes time to fix the smile. And here's an after shot of us with the teeth in the right position, having fixed the entire upper arch in one day, in one visit. We had some setup time to get everything
Is that
right.
a bit of an exaggeration?
It is not, because
Okay,
the treatment day is the day we do the action. We have some setup time, but there's one day of the patient's experience of fixing,
All right.
and I got fixed that day. So another photo here. Pretty amazing, actually, the transformation that happens with patients when you just do the smile and you just do it right. So setting it up here is the before you just showed and the after. So much more youthful. We're just sitting there laughing.
That looks very nice.
And the funny thing about it is, I mean, this is a hug event. Our office, you have more hugs. You have more sort of, believe it or not, it's friendly kisses, but hugs and kisses in the dentist than I would ever have expected in my entire life. So changing people's lives in that one day, that one treatment visit is why I go to the office. Helping people is that powerful sort of gift that we want to try to share.
So for the dentureware like this, there's no roof of the mouth cover.
That's right. It's open, so taste,
I mean, logically,
food,
it makes
flavor.
sense that they would all want to do this.
Correct.
It's just, I guess, getting them to what? Believe it?
That barrier to care is just letting them know the options there. And you want to say, hey, it's affordable, number one. It's not going to hurt. It's not going to be uncomfortable, number two. And number three, we can do this really briefly. So you don't have to live at the dentist office. So it's just a 1 day versus 6 months or whatever you'll see in other places. Another case that we did here, the gentleman in this photo hysterically just couldn't believe. I mean, it was night and day to him, the function, the reality of where he was and how quickly we were able, with a full arch cemented in the upper. We call that grade on 8.
That just means they're supported on 8 mini implants.
8 mini
But
implants.
they have full teeth.
It's porcelain top teeth, a full smile on top. You do not take in and out, permanent cemented to the patient. And I mean, it just felt like his own teeth.
A big guy, what could he eat?
Whatever he wants. We call it the third set of teeth, and that third set is you had your baby teeth when you were a kid, you lose those 6, 7, 8, and then you have your adult set. I wish they lasted a lifetime. I really do. But since they don't, we come in with this third set of teeth, fix a smile with the implants, do it in a day.
And he could chew. He could chew like on raw vegetables if he wanted to, or certain things you stay away from.
No, I mean, we're talking the most caramel of desserts, the stickiest, the hardest, beef jerky. You pick it from healthy to unhealthy. It's wide open. We're not going to hold anyone back. Another photo there is the before shots, and we have a couple fun after shots with a big reveal. And the funniest part about this patient, she was so happy with the care, and this is permanent upper smile that we fixed for her. She had a cute story. She said, we went home after the procedure. I had my teeth put in that day, and a guest came over to visit. And my husband hadn't really seen me smile because, I mean, she was still a little numb, so the lip falls a little bit. As the visitor was there and they were talking, her lip started to wake up. And it was just numbing like you'd have for a normal dental visit. And she started to show the smile, and her husband chuckled and laughed. She hadn't told a joke, and it was this little moment between the two of them. She said that the guest would have never have known, but he was so happy and content when he saw that lip start to emerge from her lip, the smile emerged.
Yeah.
That they had a nice little laugh together, and it was a really cool moment for those two. And he bought him. I mean, he fixed his wife's smile, and it was just a time that he knew that she'd made the right decision, and he was happy with helping her get what she wanted. And that's what we want anyway. I want my spouse to be happy. So he came back in the office and said, you know what? I just knew once I saw that smile that we'd done the right thing, and we were both going to really enjoy it. And now it's just days and days after.
So the process, they go in. Tell me about the sedation part of it.
Sure.
Or the numbing or whatever.
So
because it doesn't hurt during the procedure.
It does not hurt. That point is my wife's a pharmacist. It's better living through pharmacology. You have
that's
options.
right.
My wife is a pharmacist. We can line up medications. We call it twilight dentistry if you want to do that. We need a driver that'll drive you in. Very, very comfortable for the dental visit day. And then obviously, since we give you post-operative medicines, the crazy thing about that, just so you know,
All right.
patients actually don't need them most of the time.
Okay.
They come back in at 48 hours. I was like, hey, how's everything going? I actually call everyone the night of the procedure. How are you doing? You know what? I'm needing a little medication tonight. We check back in them in 48 hours, and they say, I only needed 1 pill. I only needed 2.
Are there those people that say, I only want Advil or Motrin or whatever the heck you give them?
Absolutely, absolutely.
So you could do that. There are people that do that.
We do prescriptions because we want to make sure you have it if you need it, but there are certainly folks that come in that don't need almost anything. People are actually more averse to the pharmacology, to the prescriptions, than just doing it and kind of working through.
Now, what if you have bad gums, though? So people, their teeth are loose and they're falling apart.
Yes.
How could these implants stay in there?
Gum
In those
disease,
people,
the
are they
gum
not
disease-
candidates?
You're right. No, they're candidates. And the gum disease is actually associated with the natural teeth. So there's little nooks, crannies, and pockets. And then even the gums that have moved away from the teeth that created that mobility have a little spot that they can hide bacteria. So when you remove those teeth, and that's one kind of bad part about it, but the gums then heal and can heal around an implant very healthy. And
So
anchor
even
it.
that you could do like in a couple of visits?
Absolutely. We do
Really?
it all the time. It's
So somebody with their teeth literally falling out,
immediate placement.
taking the teeth out and giving them...
And what better way to approach it from a patient standpoint? So listen to that thought process. I only want to come to the dentist and be numb once. That's all I want to do for a patient. That's what I'd ask my dentist to do for me. If you could get me numb once, I know I have to have the teeth removed, but put the implants in the same time. And now I don't have to get numb anymore. You fixed it all in one visit. So consolidating the care just means, okay, I know I have one impact on my body. Extraction and implants the same day. Everything else is above the gums. You don't need a shot or anything after that. One impact day, one treatment day, and then we make them very happy.
Good, good. And mini implants, by the way, have become mainstream? I mean, are there?
Completely.
I mean, how do they compare against traditional regular implants?
So, you know-
because I have dentists that will say, Randy, I don't know about those minis.
In the last couple months, I've placed mini implants in 3 dentists. So the term, I'm the dentist to the stars, doesn't apply to me in South Carolina. Maybe some Hollywood dentists are, but I'm the dentist in my area to other dentists.
Okay.
And behind the scenes, one was a specialist, 2 general dentists, chose mini implants for their own mouths. There's a 10-year study out that proves success rates are exactly the same as the surgical implants. So that boat has sailed. Mini implants, smaller designs.
And they're like half the cost, almost?
The price point is pretty shocking to people who come for second consults. Half, maybe a third off of what you'll hear in surgical implant offices. So really a cost savings is another way to get an opportunity for a patient to say yes and let us help them.
We're out of time. So final message to somebody watching this. Maybe they're still skeptical, or they have really bad teeth, or they're wearing a denture. What do you
If
say?
they've been told or they're headed towards dentures, they should just stop by, come in for a free 30-minute consult and find out what their options are. If they're wearing dentures, absolutely shouldn't be. It is something that we're able to fix in my office every single day. Come by for that free consult and find out what's possible. Get that upgrade, enhance, just give yourself that gift.
All right, I want to thank you so much for coming.
you.
Always a pleasure.
pleasure. Thank
Dr.
you, Randy.
Gillespie. You're watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.